All right, let's jump right in. When you think about type 2 diabetes, you probably think about insulin, right? But what if the real problem isn't just a lack of insulin, but the body's cells just not listening to it? Today, we're going to break down a really interesting drug that tackles exactly that communication problem, pioglitazone. And this right here is the core issue in type 2 diabetes. It's a state called insulin resistance. Basically, the cells in your muscles, your fat, your liver, they start to go deaf to insulin's signal to pull sugar out of your blood. It's a massive communication breakdown, and it's precisely what pioglitazone was designed to fix. So you see, a lot of other drugs work by just forcing the pancreas to crank out more insulin, just turning up the volume. Pioglitazone, which you might know by its brand name Actos, does something totally different. It doesn't scream louder. Instead, it works to help the body's tissues actually hear the music that's already playing. It makes them more sensitive to the insulin that's already there. It's a whole different ballgame. So how on earth does it do that? Well, this is where things get really fascinating and pretty sophisticated. We're not just talking about a simple chemical reaction here. No, we're actually talking about a drug that works on a genetic level. Okay, so picture this. Deep inside your cells, especially your fat, liver, and muscle cells, there's this thing called a PPAR gamma receptor. The easiest way to think of it is as a master switch that controls a whole bunch of genes involved in how your body handles sugar and fat. And pioglitazone's one and only job is to find that switch and flip it. Let's walk through how this happens, step by step. First, pioglitazone acts like a unique key that fits perfectly into that PPAR gamma lock. Once it's in, this new complex goes and binds directly to your DNA. And here's the cool part. It basically gives your cells a software update. It rewrites some of the code, telling certain genes to turn on or off. The end result of all this? Your tissues, which were once resistant, suddenly become way more sensitive to insulin. They start listening again. So, a drug that literally retrains your cells at a genetic level, that sounds pretty powerful, doesn't it? Well, it is. And that power translates into some very real, very compelling benefits for patients. Let's break down why this approach can be so effective. And these advantages are exactly why a doctor might reach for this drug. We're talking about blood sugar control that is durable, long-lasting. It doesn't just work for a little while and then fade away. It also has a nice effect on cholesterol, raising the good HDL. And this is a big one. Because it's not boosting insulin production, it won't cause your blood sugar to crash, a dangerous condition called hypoglycemia, at least not when it's used by itself. It can even help patients lower the amount of insulin they need to inject. But here's the real kicker. This might be its most unique claim to fame. According to a major study called the ACT Now trial, pioglitazone is the only anti-diabetic drug that has been proven to actually stop or slow down prediabetes from turning into full-blown type 2 diabetes. I mean, that preventative power, that's a huge deal. But, and you knew there was a but coming, right? Every powerful medicine has a flip side. We've talked about the impressive benefits, but now we have to turn that coin over and look at the risks. And believe me, this is a side that demands our full attention. I'm going to pause here for a second because this quote is pulled directly from the source material for a reason. Understanding the risks of pioglitazone isn't just some fine print. It is absolutely critical to understanding how to use this drug safely. This is the part you really need to hear. So this table gives us a really clean, high-level look at the 4 big areas of concern. We've got weight gain, fluid retention leading to potential heart issues, bone fractures, and a possible link to bladder cancer. We're going to dig into each one of these now. Okay, first up, weight gain. It's pretty common for patients to gain around 2 to 4 kilograms. That's about 4.5 to 9 pounds. And it's important to note this isn't just one thing. It's a mix of an increase in body fat, which is actually part of how the drug works, and, more worryingly, fluid retention. And that fluid retention is what leads us to the single biggest risk associated with this drug. See, pioglitazone can make the kidneys hold on to extra salt and water, which increases the total amount of fluid in your body. Now, for someone with a strong heart, that might be okay. But if a patient's heart is already struggling to pump, that extra fluid load can be the straw that breaks the camel's back. It can trigger or worsen congestive heart failure. This is exactly why the drug is a hard no. It's contraindicated for anyone with moderate to severe heart failure. And it doesn't stop with the heart. There are a couple of other really serious things to consider. Studies have pointed to a higher risk of bone fractures, especially in women, and not in the typical places like the hip, but in the arms, hands, and feet. Then there's the controversial link to bladder cancer. The data is still a bit fuzzy, but there's a signal that long-term use might slightly increase the risk, which is why it's another hard no for anyone with active bladder cancer or a history of it.
So you've heard the good and you've heard the bad. How in the world do you weigh all of this? That brings us to the final verdict, which, as you can probably guess, isn't a simple thumbs up or thumbs down. It's all about a very careful balancing act. And this slide really lays it all out, doesn't it? It's the central trade-off. In one corner, you've got this incredibly unique tool. It provides durable control, fixes the root problem of insulin resistance, and has some nice side benefits. But in the other corner, you have a heavy list of serious risks: weight gain, heart failure, fractures, and that potential cancer link. You just can't ignore them.
So here's the bottom line. Pioglitazone is not and should not be a go-to first-line drug for everybody with type 2 diabetes. The decision to use it has to be deeply personal and individualized. It's all about finding that very specific patient who stands to gain a huge benefit from its unique action and whose risks can be managed with very, very close monitoring. And that really leaves us with the core question, the heart of the matter. For the right patient, pioglitazone can be a powerful, game-changing ally. But for the wrong one, it can be a potential danger. The art of medicine is figuring out how to strike that incredibly delicate balance. And that's a conversation that is absolutely essential for any patient and their doctor to have.